And to kick us off, we have the pleasure to welcome on stage our CEO, Chuck Divita.
I want to get started and share some perspectives on healthcare. I want to talk about how at Teladoc Health we're looking to drive greater impact as we move forward. And we've been very actively integrating that and reflecting on that in terms of how we're driving our business, not just for today, but where we're investing and how we're advancing our innovation agenda. Because we know that together we have this incredible opportunity and in fact a responsibility to help people live a healthier life. But first, I think we also have to recognize that we're operating in a very complex and dynamic healthcare environment that continues to be shaped by a number of macro forces. Clearly, affordability and the rising cost of healthcare is a daunting challenge to all stakeholders, but clearly to governments and employers and health systems and health plans, and of course to individuals and families. And the prevalence of disease and chronic conditions and the toll that that takes not only on the individual, but also on the healthcare system. And you think about our healthcare providers under tremendous pressure, workforce challenges, capacity shortages, rising costs, and rising demand. And of course, technology, which continues to shape healthcare, but you've got new and emerging technologies like generative AI, and of course, medical and treatment breakthroughs. And even the most positive of those forces can have unintended consequences and implications on the healthcare system. And so that places a lot of pressure on all of us. But it also creates opportunities for us to challenge conventional wisdom and to push through and to make things better. And it's in that spirit that we want to build an even stronger partnership with you. I'm very proud that Teladoc Health has had a pioneering role in the adoption and scaling of virtual care. And today, over 100 million people in the US alone have access to one or more of our services. That's a 40% increase since 2020. Last year, we conducted millions of mental health visits. And right now, there's over 1 million enrolled in our chronic condition management programs, helping people understand their health, take control of their health and their conditions, and drive to a better future. We have, with our proprietary technology, serving healthcare institutions in over 15,000 care settings nationwide, or around the globe, I should say. I share all that because together we did that, creating more access, more convenience, driving better outcomes for people, extending provider capacity, and lowering costs. But we know there's so much more left to do because the reality of it is healthcare, as we know, remains very expensive, fragmented, and disconnected. And we think that virtual care is also too narrowly viewed sometimes. And we're missing out on these opportunities to leverage the scale and the impact and the role that it can play in the broader ecosystem. And we're not shying away from those challenges. We're taking them on, and we want to lead the next evolution of virtual care. And if we do that, we know we can drive better outcomes for you and better outcomes for people. But we do believe that virtual care can and it must play a bigger role going forward, given the magnitude of the challenges. And as we see it, virtual care is evolving. And I think Teladoc also has helped lead the way, focusing on integrated care across physical and mental and chronic conditions, really trying to put that whole patient at the center. And as we look forward, we want to leverage all those strengths, all that we've done, all those assets, learnings, and really intensify our efforts around orchestration and how we can create more seamless, connected, and personalized experience, not just in what we do at Teladoc, but more broadly as part of the ecosystem. So I'm really excited about it. It's how we can row in the same direction, focus on outcomes, and how we can take virtual care to the next level. And it's our North Star. It's where we're investing, and it's how we're focusing across patients and providers, across platforms and partners, all as a catalyst to drive better health. I think we're in a very unique position to advance this. You know, if you think about what we do, our technology and our services and our workflow, we're helping create better access, better experiences across modalities and in different settings, both virtual and in-person care. We're helping care teams operate at their highest levels to address a range of health needs, of course, physical and mental, urgent and ongoing, simple to complex. We're increasingly activating insights. We have millions of interactions, so we're looking for all kinds of new ways to engage people in targeted actions and drive better outcomes. And we're sharing insights from working across employers and health plans and health systems and with consumers. And for us, Quality, experience, and cost of care, they're not trade-offs. They're performance multipliers. And that's how, together, we are going to drive better outcomes and better ROI. Now, it may be an ambitious vision, perhaps, but we're already working closely with many of you to make this a reality. And I'd like to share some examples because I like results. So I want to talk about tangible things that we're working on. Now, you and I likely have a decent connection to healthcare, right? We get access in the care we need. But that's not the case for many people, maybe not most people. And there's not enough focus on preventative care out there. So we saw an opportunity to lean into that and meet people where they are. So we acquired a company called Catapult Health. Great company that's able to do great work in terms of on-site health fairs, things like that with employers and with health plans, but they developed a virtual checkup capability. And so meeting people where they are. We also, when I talked about orchestration, we took the opportunity to invest in our technology in something we call our Prism Care Delivery Platform. It does a variety of things, but one of the important things is it puts actionable information right at the point of care. If you're a doctor, if you're a nurse, if you're a coach, we call it a sidecar so they can see relevant information to take action. Think about care gap closures. Think about referral, navigating in a network, maybe surfacing information, think programs that you've made available. That we need to know that and we can action that. It also is our platform for connecting with others in the ecosystem very seamlessly and efficiently. So maybe you're a health plan that has a delivery system strategy, or you own primary care, or you have a joint venture, or maybe with a health system you have an ACO. We can be part of that connected ecosystem much more efficiently and effectively so we can support what you're trying to do there and vice versa. We all come from different backgrounds, but we've got a shared purpose. And we want to use our gifts and our talents and our passion to make an impact, to do something better and different than it was before. So that's really what Forum's all about, to collaborate, to share insights, and see where we can make a difference. Because the reality of it is millions of people are counting on us. People will never meet. They need us to keep moving ahead and trying our best to make things better for healthcare. And I hope you have a great event and you're able to make some connections. Thank you.